Welcome to the podcast where we fill our minds with knowledge while sipping on a cup of coffee. I'm your host, Mr. K. Now, on today's episode, we are going to talk about something that affects men. It affects you, it affects me.
Continue.
You might want to deny it all you want. Fine, that's okay. But you know it is existent. And we'll talk about it today, once and for all. So when you are looking for something humorous to listen to, or a few word time pants, or you want to get information, well, you are not far from the right place. Before we delve deep into this topic, okay, let's just take a quick coffee break. Call your brother to call his brother. That's the podcast. Hallelujah. Welcome back. Now let's just get straight into the elephant in the room. Erectile dysfunction. For the purpose of this podcast, you're going to be referring to it as ED, and I'll be referring to the thing as joystick. Now, according to the National Institute of Diabetes, Digestive and Kidney Diseases, erectile dysfunction is a condition where you're unable to get or keep an erection firm for long for satisfactory sexual intercourse. So, in simple terms, okay, your joystick can't be firm for long, or it doesn't get firm at all.
Photo, not be juju be that.
Now, if you have erection problems once a while, you know should that be issue be like that. We all go through. However, if it becomes a recurring issue, then you know that Charlie, problem they knock our day.
Chai.
According to statistics from Cleveland Clinic Center, approximately like 40% of men are affected by the age of 40. And nearly 70% of men are affected by the age of 70. Now, this is where it gets interesting.
Continue.
Globally, it is estimated that over 150 million men experience ED.
I never expected it.
And it is projected to rise to 322 million by 2025. Now, listen, 2025 is just next year. Boy, Charlie, that come. How do you know that you're having erectile dysfunction? Like, how would you know? Now, according to the Mayo Clinic in the USA, when you see these things, you have to know that Charlie, problem is knocking on your door.
Chai.
Number 1, when you have trouble getting an erection, problem D. Number 2, when you have trouble keeping the erection, problem D. Number 3, if you have problem keeping the erection or you have reduced sexual desire, then you know that there's a huge problem.
There is God, oh.
Now, what is causing all these erectile dysfunction issues? It is based on so many factors, but we'll talk about just a few. The first one is their physical health conditions. You see, there are certain health conditions that would push you to get to that stage of erectile dysfunction. Conditions such as heart diseases, diabetes, high blood pressure, obesity, all this can lead to erectile dysfunction. Now, certain neurological disorders, like certain conditions that would affect your central nervous system, like multiple sclerosis, Parkinson's disease, stroke, they can all disrupt the signals between your brain and your joystick. So your brain no go feel talk your joystick see something interesting there. Certain hormonal imbalances too, it will cause the erectile dysfunction. So let's say your male sex cells are low, it can lead to it. When you have thyroid issues too, it can also bring it. Now, certain psychological factors can cause erectile dysfunction. Stress, anxiety, depression, relationship problems, financial issues, it can cause erectile dysfunction. So, if you have any of these problems, please try to tackle it. If not, 2025, the number will increase. Certain medications we take can also cause erectile dysfunction. like antidepressants, blood pressure drugs, chemotherapy drugs, they all worsen it, or they are even a side effect. Now, sometimes the things we do bring about certain conditions to us. Smoking, excessive alcohol consumption, drug use, and a sedentary lifestyle can all contribute to erectile dysfunction. Now, I'm not the one saying this. This is all detailed in the book, What Causes Erectile Dysfunction? And it was written by the Urology Care Foundation in the USA. People have so many thoughts about erectile dysfunction. Some thoughts are misconceptions. Now, let's just look at certain misconceptions around it, okay?
Continue.
Number one, if you're a young man, you don't have erectile dysfunction. It's a big lie. You can be a young man with a medical condition that can lead to erectile dysfunction. They also think that, okay, if you have struggled in the bedroom once, then it means you have erectile dysfunction. That is not true. Sometimes you just have our off days. Go shut up, perform like the way they want to perform. They mean say get erectile dysfunction. Another one to say that only medicine can treat erectile dysfunction. That is not true. What if your condition that is causing erectile dysfunction is not medical? Let's move on straight to how erectile dysfunction can affect your life. The common one is that it can lead to embarrassment. See, the match set give you everything set. Conditions are favorable. Then light off.
Photo, not be juju be that.
It's a huge turn off for the ladies. And it can affect your self-esteem as a man. It can affect your ego going forward. It can even lead to anxiety and all those kind of factors where you feel like you're not good enough. It can also be a symptom of an underlying health condition. So maybe you might not know that you have high blood pressure. You might not know that you have sclerosis or something. Sometimes it might even lead to emotional breakdown or intimate breakdown. Partners might feel rejected or unattracted, leading to resentment or distance in the relationship. Now, let me just give you this fact. If you ignore the symptoms of erectile dysfunction for long, it means you are delaying the process of solving it. And in delaying the process of solving it, it can lead to so many complications. See, all hope is not lost. All hope is not lost. We can find a way of dealing with erectile dysfunction. However, you need to understand the cause. See, if you don't know the cause of a problem, you can't solve it.
I don't want trouble.
Now, let's look at how to treat erectile dysfunction. Certain lifestyle changes can help manage and treat erectile dysfunction. Eating a balanced diet, maintaining a healthy weight, avoid smoking, and excessive alcohol consumption can help to improve the overall health and sexual satisfaction of an individual. Number two is medications. Certain oral medications like sildenafil, we normally call it Viagra, can be used. Now, this has to be prescribed by a health practitioner. Now, these drugs are normally taken shortly before the sexual activity. You understand? So you don't have to take it every day. No, it's only when you're about to have a sexual activity. The third way you can use is the psychotherapy. You can talk to a counselor, you can talk to a psychologist to deal with your problem. As we said, some factors such as stress, anxiety, and depression can cause erectile dysfunction. Therefore, you need to just, take your time and talk to somebody who could counsel you or talk to you in a nice way for you to get over it. Now, you can use certain alternative methods. Some methods are not really popular here in Africa, like penile injections and all that. We are not used to it, but those are also alternative. Now, that's a wrap on our erectile dysfunction adventure. I know that from what we have done today, you would be able to get over it and now walk as a man that you are. This has been your favorite coffee and info podcast with me, Mr. K. Kindly subscribe to our YouTube channel, share, like, push the notification button, and then give me a comment, okay? Until next time, remember, when life gives you lemons, you know what to do.
Music Factory.
See, holy pa them want to see a man fail. But me no care cause me ja no send them. Them have no peace.